Welcome to our comprehensive exploration of epilepsy. As we embark on this enlightening journey, we'll delve into the heart of this intricate neurological condition. Epilepsy, often shrouded in mystery, is in essence characterized by recurrent, unprovoked seizures. These seizures are not random events, but rather manifestations of abnormal electrical discharges within the brain. These discharges cause transient disruptions in normal brain activity, leading to the characteristic symptoms of a seizure. As we navigate the complexities of this condition, it's essential to debunk a prevalent misconception right from the start. Despite common myths, epilepsy is not contagious, nor is it infectious. This understanding is crucial to dispelling the unwarranted stigma surrounding epilepsy, fostering empathy and promoting inclusivity for those living with the condition. So, as we continue our journey, remember, epilepsy is neither contagious nor infectious. Now, let's delve into the multifaceted realm of epilepsy etiology. Epilepsy, a complex neurological condition, can be triggered by a wide array of factors. No two cases are identical, and the causes can vary as widely as the individuals who live with the condition. Firstly, genetics play a pivotal role. Some individuals inherit specific genes that make them more susceptible to the abnormal electrical brain activity that leads to seizures. However, it's important to note that most forms of epilepsy are not purely genetic and often involve a combination of genetic and environmental factors. Moving on, traumatic brain injuries can also precipitate epilepsy. Whether these injuries result from accidents, falls, or strokes, they can cause changes in brain structure and function, leading to the onset of seizures. Similarly, brain tumors can instigate epilepsy. This happens when the tumor disrupts the normal electrical activity in the brain, sparking seizures. It's crucial to remember that not all brain tumors cause epilepsy, and not everyone with epilepsy has a brain tumor. Infectious diseases, such as meningitis or encephalitis, can also lead to epilepsy. These conditions cause inflammation in the brain, which can trigger seizures. Prenatal injuries and developmental anomalies also make the list. Mothers who experience infections, poor nutrition, or oxygen deficiencies during pregnancy increase the risk of their children developing epilepsy. Developmental disorders like autism and neurofibromatosis can also increase the risk. And then there are those cases where the cause remains a mystery. Despite advances in medical research, sometimes the triggers for epilepsy remain unidentified. These are often termed as idiopathic or cryptogenic epilepsies. In conclusion, the causes of epilepsy are as diverse as the individuals it affects. They span the spectrum from genetic predispositions to brain injuries, from brain tumors to infectious diseases, and from prenatal injuries to developmental anomalies. Occasionally, the triggers for epilepsy remain unidentified. As we continue to explore the expansive realm of epilepsy, we hope to uncover more about its complex etiology, paving the way for improved diagnostic techniques and treatment strategies. Transitioning to remedies, effective epilepsy management revolves around seizure control and enhancing overall quality of life. The primary line of defense against epilepsy typically involves pharmacotherapy or the use of anti-epileptic medications. These drugs work by altering the electrical activity in the brain, effectively reducing the frequency and intensity of seizures. There is a wide array of anti-epileptic medications available, and healthcare professionals will often tailor treatment plans to the specific needs and circumstances of each patient. Beyond medications, lifestyle modifications can play a significant role in managing epilepsy. This can include prioritizing adequate sleep, as lack of rest can sometimes trigger seizures. Adhering to a balanced diet, maintaining regular exercise, and avoiding known seizure triggers such as flashing lights or extreme stress are also important aspects of epilepsy management. Stress management strategies can be particularly beneficial for those living with epilepsy. This might encompass mindfulness techniques, yoga, or other relaxation practices. These methods can help to manage the emotional and psychological impacts of the condition, promoting overall well-being. In some cases, when medications and lifestyle modifications are not sufficient to control seizures, surgical interventions may be considered. These procedures aim to remove or isolate the area of the brain where seizures originate, known as the epileptogenic zone. The type of surgery will depend on numerous factors, including the location of the epileptogenic zone, the type of seizures, and the overall health of the patient. It's important to remember that each person's journey with epilepsy is unique, and what works for one individual may not work for another. The goal of treatment is always to minimize seizures and improve quality of life, while minimizing side effects as much as possible. In select cases, surgical interventions aimed at resecting or isolating epileptogenic brain regions may be necessary. However, any decision regarding epilepsy treatment should always be made in consultation with a qualified healthcare professional, considering the potential benefits and risks. Moreover, fostering robust support networks and promoting education prove pivotal in navigating the challenges associated with epilepsy. It's more than just a medical condition. It's a journey that often requires emotional resilience and a strong support system. Joining support groups can be incredibly beneficial. These communities provide a safe space to share experiences, learn from others, and receive emotional support. Professional counseling is another valuable tool. Psychologists and therapists can provide strategies to cope with the emotional toll of epilepsy, offering ways to manage stress, anxiety, and other psychological aspects linked to this condition. Education plays a crucial role too. Understanding the intricacies of epilepsy enables individuals to manage their condition better and dispel any existing misconceptions. It fosters an environment of empathy and inclusivity, helping society understand and support those living with epilepsy. But remember, there's no substitute for professional medical advice. Seek prompt consultation from a qualified healthcare provider if you have concerns. Please share, like, and subscribe to help erase stigma. Thanks.